So what you have here are the contents of the bandage kits that we send home in our equine bandage kit. So the first thing you'll have is your non-stick dressing. You also will get a pack of gauze sponges, a small roll of gauze, a sheet cotton, a brown gauze, a vet wrap, and an elasticon. So when you go to apply your bandage, you want to try to avoid touching the bandage material as much as you can, so opening it cleanly. The first areas or layers of the bandage that you'll need will be your non-stick bandage that'll go directly against the wound or the sutures, the 4x4s to go behind that, and the roll gauze. So using just a corner, you can lift the sterile gauze and place it on your gauze pad, but again, try not to touch the middle where it's going to be against the horse's skin. This can then be taken gently out of the tray by the corner again to avoid touching the center. So when you're doing a Hock bandage, you want to tie up the tail to keep it out of the surgical site or the wound site. You can just accomplish this with a quick release knot put in their tail, and usually that'll stay in place. So for example, if there was a wound or a suture line here, you would want to gently place your gauze up over the area of the sutures, and then using this roll gauze, wrap relatively loosely, just tightly enough to hold the gauze in place underneath. And with hocks or anything with a bony protuberance like this, you want to use a figure of 8 pattern to secure up over that and then come back down around it, ideally not wrapping directly over the point of the hock. And so again, you can come up over and go back down as you go to secure your gauze in place, but without putting pressure on the point of the horse's hock. When you reach the end of your gauze roll, you can just tuck the end in to hold it in place while you get ready to put on the next layer of your bandage. So once your roll gauze part is on, the next step will be the sheet cotton. This will come in this blue outer casing to keep the sheet cotton sterile. As you open it again, you want to not touch it excessively, although it's okay to touch it to some extent as you're going. So the sheet cotton will be held in place with the brown gauze. That comes in this paper tube. You can pull that out, and then you'll take your sheet cotton to apply to the limb. When you apply your sheet cotton, you want to center it right over the hock and try to apply it with a nice snug pressure like you would with a standing wrap or a quilt. It doesn't need to be very tight, but you want to try to apply it evenly if possible. This can be difficult over areas such as the hock where you're going to have a little bit of an uneven surface to wrap. Once your sheet cotton is in place, you secure it with your brown gauze. Your brown gauze you want to apply with firm, even pressure, overlapping about 50% of the previous round with each pull. With this, you want to leave a small portion of the cotton poking out at the both bottom and the top to ensure that you do not put excessive pressure directly on their skin. So again, about 50% overlap as you go, pulling across the front of the limb to tighten it. And as always, make sure you're wrapping in the same direction with each layer of your wrap. And again, with the bottom, we're going to ensure there's a little bit of cotton sticking out, and then work your way back up the limb. And while we do directly go over the point of the hock with this, you try not to put much pressure on that area with your brown gauze as well. When you reach the end of your brown gauze, just like with the white gauze, you can just tuck the end in to keep it in place while you get ready for the next layer. The next layer of your bandage will be the Power Flex or vet wrap layer. That's a stretchy, colorful bandage. That's going to be placed directly on top of your brown gauze in a firm fashion. You don't want to pull as tight as you can, but you want to pull enough that the wrinkle that is inherently in the bandage stretches out a little bit as you go. Again, you want to overlap by about 50% with each layer as you go down the limb. And as we go right over that point of the hock, we try to release that pressure a little bit so as not to put too much pressure there. When you get to the bottom of the bandage, just slowly work your way back up, just like with any other wrap that you would place. When you get to the end, as the vet wrap secures to itself, it'll stay in place for you. The last layer of the bandage that we like to apply is the elasticon. This is an adhesive bandage that will help prevent dirt or shavings from getting into the bandage, as well as help keep it from sliding down the leg. When we place this, we place about half of the elasticon directly onto the bandage and half of it on the skin. And with this, because it is so elastic, you want to apply it loosely to the horse's leg and use about 1 or 2 go rounds. You do not need to cover the entire bandage with this layer. Once you've secured it, you can then cut it and use the remainder of your roll for the bottom. Sometimes it helps to pre-stretch the elasticon to make sure you don't put it on excessively tightly. You'll repeat the same thing at the bottom with half the elasticon on the bandage and half on the skin. The last step with the bandages over the hock is to make a cut in the back of the bandage directly over the hock, and what this does is release any pressure you've placed over the point of the hock and help prevent bandage sores. Here we oftentimes will use a scalpel. You can use a sharp scissor or anything that can cut through the bandage material and just make a small incision that goes down through both the vet wrap and the brown gauze so you can see the white sheet cotton underneath. Once you've created that small cut, you then want to overlay it with a little piece of elasticon just to keep any debris from working its way into the bandage. You can put this on just like that, longitudinally over the bandage. Again, just to cover up that little area and prevent any debris from working its way in. And once you've applied that, you are done with a hock bandage.